some really dire numbers that we didn't want to ignore or lose in the mix of other significant news that's going on here. Let's go ahead and throw this tear sheet up on the screen. So fentanyl overdoses have become the #1 cause of death among U.S. adults age 18 to 45. That is being described accurately as a national emergency. Here is some of the data. So between 2020 and 2021, so in those 2 years, nearly 79,000 people between 18 and 45 years old, 37,000 in 2020 and 41,000 in 2021 died of fentanyl overdoses. That comes from a data analysis from an opioid awareness organization, so an activist organization called Families Against Fentanyl. They doubled in 2 years between April 2019 and April 2021. In the first 5 months of 2021 alone, more than 42,000 fentanyl overdose deaths were reported. That represents an increase of more than 1,000 fentanyl deaths per month compared to the same time period. So again, it just keeps escalating and escalating and escalating. And Saagar, I thought there was a really interesting comment here. You know, we have this thought of like, you know, it's mostly heroin users, opioid users who end up having fentanyl instead of their drug of choice. But one of the experts here says it's showing up in all parts of the drug supply. Fentanyl has been found in all the drug supply, they say. That's why anyone using drugs, not just opioids, should carry naloxone. The only safe place to obtain drugs is the pharmacy. So, you know, it's just dire. And we should also say here that this is a U.S. problem. I mean, other countries around the world are not seeing this spike in overdose deaths. So there is a real failure here. There's a mass social cultural failure. And there's also, listen, I mean, the problem with the war on drugs when you have total prohibition is that fentanyl is the most concentrated dose. So it is the easiest thing for traffickers to bring across. It's the same thing we saw during alcohol prohibition. It was the, you know, the highest level of alcohol, the most concentrated doses of alcohol. It's the same thing here. And that's why you're ending up with fentanyl throughout the entire drug supply, leading to these incredibly tragic outcomes. People are not choosing fentanyl. You know, people are struggling with addiction. They're not wanting and going out and seeking fentanyl. But because it is so concentrated and because it's so easy for traffickers, that's how you end up with it throughout the supply.
I mean, these sociopathic traffickers are just slipping it in basically to everything.
Everything.
It's an easy way for them in order to pad their drugs and all of that. It really is horrible. I also think it is worth and useful to stack it up against Omicron that we just discussed.
Absolutely.
Imagine if we treated it with the same level of seriousness. The #1 cause of death that we now have for people between 18 and 45 is an illicit drug. Now, whether you fall on drug control policy or not, we should declare that a crisis and convene and put all the same national level of attention and discussion and all of that. But a lot of people won't do it. And you know why? It's because rich people and people at the top can get Omicron, can get COVID, and the people who are predominantly dying of this are much more poor, disproportionately not likely to be represented in higher society. I really think that's what it is.
We also have a moral panic around drug use that prevents us from having like an intelligent conversation about it. So I'll give you a perfect example of this. One of the things that Dr. Carl Hart advocates for is there should be widespread testing capability of your drugs too. I mean, if you're just trying to keep people from dying, users should be able to know what is actually in their drugs. Now, obviously, I would advocate for decriminalization, the Portugal model, so that you can go and you get it from an official source so you know that this supply is not going to kill you and it's highly regulated. But barring that, having just the widespread ability to know what is in your drugs would save so many lives. And ultimately, I mean, that's the place where we are right now. Let's just keep people alive and give them a chance at recovery if they're struggling with addiction. But because we have like a lot of sort of moral panic around drug use, it clouds our thinking so that no one's even courageous enough to advocate for that or to offer that at the political level.
I think that could be part of it. I also think that a huge part of it is also just like the hole at the center of our culture, which is what obviously is part of this. As you say, it's just a U.S. problem. It's clearly, it's downstream of a massive number of effects, job loss, lack of upward social mobility,
100%.
inability to, find a mate, whatever, on the male side, on the female side, possibly, being abandoned. I mean, it's just like there's so many different sociopathologies that come together. But look, I mean, at this point, I'm just for any type of discussion, for saying like, what the hell are we going to do about this? Because it is not declared or looked at in nearly the same panic or concern that we have around a lot of these things. And I'll say maybe one benefit of COVID for me personally was it made me take my health a lot more seriously and be like, okay, let's have a real honest conversation here. And when you start having real honest conversations around obesity and being overweight and all of the downstream effects it ends up having on your life, you can make a lot of different unconscious life decisions. Say, nah, I don't need that, or I'm gonna do this, or I'm gonna do this differently, or whatever. There's a lot of different behaviors that you can engage in. We don't even have the same level of conversation around fentanyl or drug use. I think that's a huge problem. And really, to me, I mean, we don't treat it with the seriousness that it deserves. And people shouldn't, I mean, we have a problem here, right here. You can see it all across the city. People, leaning over after having just shot up, passed out on the side. It's just no way to live, both in having on the streets, but also for the people themselves. I know people who I, grew up with or who ended up dying like in a McDonald's bathroom. You can't have that. You can't. And it's not treated even close to the same level of seriousness. Right and left actually do care about this in two distinct different ways, but there is, I think, some form of consensus that could possibly be reached if we treated it with the same level of seriousness. But a lot of elites just don't want to have that conversation.
Yeah,
it pisses me off.
This was one of the things that was a real draw for Trump in 2016.
Huge. Chris Christie, do you remember that?
Yeah.
His speech about what I think was a daughter or something that had a problem with heroin use. It was a big moment for him.
It was a big conversation in the 2016 election. Hillary Clinton also talked about it because New Hampshire was extraordinarily hard hit. I mean, that's part of why it grabbed the national news attention, because New Hampshire, obviously a key early primary state and all of it, and a key swing state in the general election. The numbers are so much worse now than they were in 2016. And it's just fallen off the national radar. And so I do think it's like, why are some deaths treated with more seriousness and care than other deaths? And there is a lot of like moral judgment. Like another example of this is there's a lot less money and funding for research for lung cancer because it's seen as like, oh, well, it was
because of smoke.
It's your fault.
I see, yeah.
Right. So there's like a contempt towards it. And I think that there's a similar dynamic here, and people, because it's a hard problem, people have just sort of stopped talking about it and stopped focusing on it. But for the families that are affected, that, have lost loved ones, which there are so many in this country now, it's absolutely devastating, and people deserve a lot better. So we're not going to let it fall off of our radar, so to speak, and continue to bring you the updates. But so far, they've been very grim.
That's right.
Hey, guys, thanks so much for watching.
That's right. Just as a reminder, you can become a premium subscriber today. Watch the full show completely uncut, our reactions to each other's monologues. You get to listen to it. You get to ask us questions, all that good stuff. Link is right there in the description or at breakingpoints.com.
Best of all, great way to say screw you to the mainstream media.